Hey, it's Dr. Waymire with Dragonfly Menopause Care. I wanted to talk to you about vaginal estrogen, which is the form of estrogen that the FDA removed the black box warning from just recently. So vaginal estrogen prevents bladder infections. It treats the genitourinary syndrome of menopause, which is when the vaginal tissues get very thin and dry and you can get pelvic pain, etc. Just discomfort generally in that area. And vaginal estrogen is amazing and it heals those problems. It can actually prevent urinary tract infections. And so I have a couple patients. One was an 80-some-year-old woman who had wanted vaginal estrogen. Her daughter thought she should have it because she's had bladder infections and her doctor wasn't comfortable prescribing it. So she saw me for just that reason, and I did start her on vaginal estrogen, and then I added an appointment for vaginal estrogen only for women who don't want any other hormones, but they do want their vaginal estrogen, and their doctor may not be willing to prescribe it because of discomfort because of the old warnings about the medication. And then I had a patient today who is in her 70s, and she is so excited about how she's doing since starting vaginal estrogen and other hormones too. But the vaginal estrogen is a big deal because she's had symptoms of a bladder infection for the longest time, and she's been dealing with it for so long that she didn't really think it was going to ever go away. And amazingly, but not surprisingly, because I've seen it before, she's started vaginal estrogen, and at follow-up, she hasn't had any symptoms of a bladder infection at all. And she's so excited. She wants to tell everybody. So I hope she does. And if you are having these symptoms, I would love to see you. I'd love to help you. If you're in your 70s and you want to talk about hormones, I would love to see you. I would love to help you and talk to you about that and let you know what your options are. Thanks so much, and I hope you have a really great day.